It is 2 after, so we'll go ahead and get started here. We have MCTTD at least has a relatively short agenda for today. And so I'm gonna try to go a little bit slower than I normally talk. So we're gonna talk a little bit about the end of the year deadlines, reminders. Some of them have passed, but these are just kind of heads up and kind of reminders about the ones that haven't. We'll talk a little bit about the 2025 Learning Community Event series that I know that you're all familiar with, but talking a little bit about the content and topics that we have put together based off of your feedback, as far as the agenda that we'll have lined up for 2025. We'll talk a little bit about the December data update for the patient data dashboards and what that means for the performance measure reports that we'll be sending out for those POs and practices participating in the performance measure. We'll talk a little bit about the A1C, uncontrolled A1C form that you'll be submitting as a part of that performance measure, and then talking about some next steps related to the prediabetes resources that we'll be creating, again, with the feedback that we've received from you all as the collaborative. So this is a very busy slide. These slides are sent out after the meeting, so you don't need to memorize all of this right now, but there are 3 main deliverables as far as what is currently kind of in season, if you will. So you can see here we have the physician level survey related to the current knowledge and comfort with MCTTD initiatives. And so that was due on December 13th. And the different point levels were determined by % of physicians that completed it. The practice clinical champion had to complete all of the MCTTD training. So as a reminder, there were 4 of those: the CGMs, guideline-directed medication prescribing, low carbohydrate diet, and the tying it all together. The point designations here are based off of when all 4 were completed. And so we are past that initial time frame, but completing all 4 by January 31st gets you 7 points. The patient needs assessment, the requirement on that was to collect a minimum of 10 responses per practice. We have original deadline of 12/13/2024. We are in a grace period right now for that, for the very few of you wrapping up the last 1 or 2 surveys. We will accept those through December 31st, but please do try to get those in ASAP. The patient needs assessment data will be updated again on the admin portal, both on December 19th and on December 30th. The tracking for the clinical champion training will continue to be updated every Monday as well, since the partial credit again is still possible. All right. So some additional deadlines, these are a little bit further out, but for continuing practices, all 4 of these bullets here are due on July 1st of 2025. So that's the physician level learning community VBR credit, the practice level learning community VBR, as well as the PO learning community VBR. And then finally, the 5 uncontrolled A1C forms per practice or aggregate group will be due again on that July 1st time. As a reminder, only 5 uncontrolled A1C forms are required for an aggregate group. So if you have an aggregate group of practices that's measured for the performance measure as aggregate, they only need to submit 5 patients across that 1 aggregate group. So if you have 3 practices that had less than 100 patients and as such are being measured as an aggregate group, all 3 of those practices together only need to submit 5 patients. However, if you have a practice that had over 100 patients and for the purposes of the performance measure is measured individually, that practice is on the hook for submitting 5 patients of their own. For new PCP practices, the reflection on the patient needs assessment will be due on February 3rd. We'll be sending out the results of that in early January. We're currently getting those reports ready for you. The physician level learning community requirement will be due for the new PCP practices as well on July 1st, as well as the practice and PO level learning community requirements. All right, so speaking of learning community, here is our current lineup. Question here. What if an independently measured practice with greater than 100 patients doesn't have 5 uncontrolled patients? Great question, John. Reach out to us if that's the case. If you have a practice that we sent the list of patients to and they did not have at least 5 that were uncontrolled at the time of the baseline report, let us know and we'll figure something out for you. I don't recall seeing that being the case, but that doesn't mean it didn't happen. All right, so learning community events for 2025. Right now we have a total of 10 scheduled. We do typically try to do 10. Or right now, I think we have, let's see, 3, 6, 11 scheduled at the moment. And so we'll be trying to hit all of the main topics that you guys had put together and put forth as the areas of interest for the collaborative. And so we're starting out in late February, early March, as we usually do with the ADA standards of care updates. And so that'll be focused on the updates that just came out or will be coming out for 2025. We'll then be going into incretin-mimetics, national nutritional considerations, and more, talking about side effects as well as some misconceptions. We'll then go into insulin and type 2 diabetes in April, diabetes complications, and we're going to have a two-part series on this. The first will be focusing on foot care and neuropathy, and then the second part will be focused on cardiovascular and eye care. So at each of those, we'll have two specialists. So the foot care and neuropathy one will have a podiatrist that specializes in diabetes-related foot care, diabetes-related podiatry care, speak to us for about 20 minutes on foot care, and then we'll have a expert on diabetes neuropathy for the second 20-minute section on neuropathy. Same for cardiovascular, and I will have an ophthalmologist for the eye section and a cardiologist for the cardiovascular section. There is a second insulin and type 2 diabetes here, which should probably be a typo, which we will address, which is why there's 11 on here instead of 10. Exercise and lifestyle in type 2 diabetes, patient behavior change, pre-diabetes resources, social determinants of health, and low carbohydrate diets. All right, for the December performance measure reporting, this will go live on the dashboard at the end of the month. So as most of you are probably familiar, on the summary measures page, we have that visualization at the top. There is not a sign in for today's meeting, Blair. We'll be tracking you via Zoom. The performance measure revised population that we talked about a few times will be available on the patient data dashboard summary measures page starting this Friday. The toggle will be available on that visualization. So at the top of it, you'll be able to see what two different options for your views. One will say overall population. That's what it's currently reporting on in the current view. And that's for all patients that are attributed to your practice. And then performance population will narrow it down to the performance population as defined by MCTTD that was sent out to the POs at the beginning of the performance measure. For the performance measure reports, the push reporting that we'll be sending to you, PDFs, if you will, that will be sent out to you, the POs, in early January. That will have data through September 30th of this year. As a reminder, we do have about a 3-month data lag, but another thing to look forward to in 25 is that data lag will be decreasing. So that just as a quick reminder, this is what the performance measure reports will look like coming again in early January. So we'll have each practice that is within your PO that is participating in that performance measure broken down individually and whether or not it's being measured independently or in aggregate, and then their current performance. We'll also include definitions at the top to remind you what the exact criteria for the measures are. And then we'll go into practice-specific reports that will report out on the patient measures, both for Medicare patients and commercial patients, and including some number of patients with an A1C and the number that we have not seen another A1C for since the baseline. This is a useful tool, useful visualization for you guys to be able to see how many patients have been seen for follow-up since that original baseline report was sent out. Obviously, you won't see a lot of change in performance if patients don't have any subsequent A1Cs. So that's a useful visualization that just wanted to call your attention to. All right. Switching gears here over to the uncontrolled A1C form. So I briefly mentioned on this again earlier, but I'm gonna say it again. The aggregate measurement groups only need to submit 5 patients total, whereas an independently measured practice would need to submit 5 patients. Again, to John's point, if you have a practice that has over 100 patients in that baseline report and as such is measured independently, and they did not have 5 patients that were uncontrolled at the time of the baseline report, reach out to us. I don't think that's a very prevalent issue, but if you do see that, let us know. And then the tracking will begin being available in the admin portal in January. So you'll be able to see as you're submitting those, how many your practices have submitted so far. And again, as with everything, if you see tracking that's not adding up or that you think that you have practices submitting more than you are seeing in the admin portal, please let us know. All right. If you have not sent those baseline files, I hope you have at this point, but if you have not sent those baseline files to your practices, please do so as soon as possible. We have received a couple of, well, actually numerous emails from practices saying that they've heard about these baseline reports, but they haven't gotten them yet. So please make sure that does happen. All right. I briefly mentioned the reduction in data lag for 2025. So this is, again, not something that you need to read in its entirety. These, again, will be sent out, but this is the data release schedule for 2025. The claims and clinical data lag will be shorter, as we talked about in the November PO monthly call. Will be decreasing about 2 weeks with potential for more. And so that's the conservative estimate as at the current moment. But the goal, as always, is to continue to decrease that data lag and continue to provide you guys with as most actionable up-to-date data as possible. We will, as always, have 4 enhancements to the data, and we're continuing to build out our version of Dashboard 2.0, including additional features and functions, such as the pre-populated reports and revised patient list and patient profile pages, which will all launch within 2025. So we had reached out at the regional meetings to all of the different clinical champions and attendees about what type of resources would be most useful for them surrounding prediabetes. And the 3 main another question in the chat. Let me just address this. What if patient changes insurances or changes to a different PCP during the measurement year? Yes, particularly if these circumstances are deemed uncontrollable. So I'll address the first part of your question, John. So if a patient changes practices, for example, during that measurement group, they're going to fall out of that baseline population. We're not that practice. Let's say they're sitting at 100 patients exactly, and as such, we're measured independently. That's not going to make them start being measured in aggregate. We built in enough leeway, if you will, where we're okay with a practice if they had 3-4 patients change practices during the measurement year, fall out, and now they're measured independently with 96 patients. That's fine. That 100 patient cutoff is determined at the beginning of the performance year. But like say if a patient changes practices, that patient to a different practice or especially to a different PO, they'll fall out of that denominator for that practice. They wouldn't join that other new practices denominator either, because we don't want to hold that practice accountable for when a patient is joining them halfway through the performance year, for example. The second half of your question, particularly if a patient with these circumstances are deemed uncontrollable. Yeah, great question. So like say, if the patient has moved, they'll fall out of that denominator. We are pretty generous with that criteria. So we didn't want to create a scenario where a practice had less than the full performance year to make changes with that patient. Question from Laura Peterson: is the baseline report the Excel document that was shared via SharePoint in September? Yes, that is. Correct. And the subsequent reports will be in PDF format, and that'll be coming forward again in early January. All right, so the prediabetes resources, like say, we had solicited feedback from you all at the fall regional meetings that, again, we had a topic about, and we had a presentation from Caitlin McEvely Rosenbach from the National Kidney Foundation talking about the diabetes prevention program. And so there were a lot of themes surrounding that diabetes prevention program, specifically lists of programs and payers who cover them. And so that'll be a tool that we're putting together. We'll be looking to put a tool together around specific screening criteria for prediabetes, guidelines for screening, and what exactly the definitions or the consensus statement on what the definition of prediabetes is. Free resources, classes, handouts, and webinars for patients. So more patient-facing materials and patient-facing resources as well. Those are going to be the 3 themes of tools surrounding prediabetes that we'll be focusing on for 2025. All right. All right, so the newsletter went out yesterday, our MCTTD quarterly newsletter, and in that newsletter, there is a link to an MCTTD order form. That order form is available for all clinical champions at your practices to order 3 things. 1, the low carbohydrate diet keychains that you've heard us talk about and that we've shown some pictures of on these calls in the last couple of months. For those practices that do order those, we'll be shipping the keychains to the POs and asking that the POs distribute them to the practices that ordered them. Fortunately, MCTTD just doesn't have the bandwidth to ship to over 350 practices. And so it'll be a group effort. We'll ship to all 23 POs and then ask the POs help us distribute to their practices. And then the other items on that order form that will be available are a number of different tools that are heavily used as printouts. So the printout heavy tools, as well as additional posters. So these are the same posters that you guys have had the opportunity to pick up at regional meetings in the past. But we did want to open this up and allow for another round of ordering. So for example, if a poster is gotten kind of like crinkled or something and you need a replacement, that's fine. Or if you have additional practice rooms that you would like to put one of these posters in, this is an opportunity for you to order one for that. For posters and tools, however, again, just due to the magnitude of shipping and the weight with which that is for shipping, we will be having those as pickup at the spring in-person regional meetings and allowing the clinical champions for the practice that ordered that set of tools and posters to pick them up and take them back with them then. All right. That is the end of today's MCTTD portion of the meeting. So our next calls will be after the holidays. So Wednesday, January 8th from 2 to 3 p.m. and then Monday, January 13th from 11 to 12 p.m.